I'm a warrior. I even have a tattoo on my arm that says it. I'm a warrior because I'm a fighter. I keep going. Although sickle cell is a really painful and terrible disease, I still try to look at the good from it. I am still able to thrive. I'm in school. I am still able to work. And just being able to push through, like, because sometimes I can be in a 10 out of a 10 pain and I'm still at work and I deal with patients all the time. And sometimes my coworkers don't even know that I'm in pain because I know how to mask it so well.
Sickle cell anemia is a genetic blood disorder. Instead of blood cells appearing in a circle, sickle cell patients' blood cells are crescent-shaped, like a banana or half moon, causing a lack of oxygen in the joints.
How I like to explain it is like glass shattering, like in the inside.
When Deasia is on her menstrual cycle, the pain intensifies. It's why she relies on birth control to help reduce her pain.
It's just aggravating other things, and then the heavy bleeding alone can affect my sickle cell. So with the birth control, it is for the doctor to try to control my bleeding to help get that under control so my sickle cell can be under control.
Sickle cell research was one of the many items studied in a report released by a small team at the Center for Disease Control. The team produced guidelines called the Medical Eligibility Criteria for Contraceptive Use, which included an app anyone can download and laid out recommendations for physicians with patients who have chronic kidney disease, and revised recommendations for people who have sickle cell, are breastfeeding, postpartum, are obese, or have heart disease, allowing physicians to prescribe the right contraception to women with underlying medical conditions.
People who have fibroids do much better when they're able to be on a form of contraception. Endometriosis, the first-line treatment for that as well is birth control. And so really these medications help us take care of a wide variety of health conditions.
In April, that team's work stopped. The app, which was downloaded nearly 500,000 times, according to the CDC, frozen in time with 2024 data.
I want to promise you now that we're going to do more with less.
Workers were RIFed, which stands for Reduction in Force, and then terminated as part of the Department of Health and Human Services downsizing of the federal agency.
No American is going to be left behind. Our key services delivered through Medicare and Medicaid, the FDA and CDC, and other agencies will enter a new era of responsiveness and a new era of effectiveness.
Secretary Robert F. Kennedy Jr. with the Department of Health and Human Services addressed the massive budget cuts in March.
Now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000. We're keenly focused on paring away excess administrators while increasing the number of scientists and frontline health providers so that we can do a better job for the American people.
What were your thoughts when you heard about the elimination of that particular team?
It was actually very terrifying because that us as a sickle cell community, we don't already have the research for sickle cell and reproductive health. That being eliminated, it's like, okay, that was the one thing that we did have.
Lee Warner knows how important this work is. He's a former chief of the Women's Health and Fertility Branch at the CDC, which worked on the data collection. He retired just before his colleagues were RIFed.
So it was a shock, and a shock for our branch to be RIFed as well, and all the staff.
Warner worries not just for his former staff, but for Americans who depended on this research.
The guidelines are of use to 47 million women in the United States who use contraception. And we know that 90% of women have used method of contraception in their lifetime. So that it has broad relevance to half the population.
It's not just researchers concerned.
You know, I didn't realize how much I took those contraceptive guidelines for granted until they were gone.
Dr. Andrea Braden is medical director at the Atlanta Birth Center.
The contraceptive guidelines were just one thing that kind of took the weight off of us. They are trusted physicians and researchers and public health representatives from the CDC who we know do rigorous research, who look at all the data and really weigh it out and are able to kind of filter through all the evidence that's out there so that we can give evidence-based guidance about contraceptives to all of our patients.
Our national investigative team asked HHS repeatedly for an on-camera interview with Secretary Kennedy. We want to know if the work conducted by the team will continue. In a statement, they replied that critical programs under the Division of Reproductive Health will continue under the Administration for a Healthy America. But they did not specify how, never explained what staffing will look like, nor described if the guidelines produced to physicians will continue.
I've also heard nothing to suggest that this particular work on the contraceptive guidelines for healthcare providers will be incorporated into the AHA.
It shouldn't be right for them to be able to take that from us. Like, we all should be able to be educated about what's going on in the world. And birth control is just one of those things, although a lot of people don't think that it is important, it is very important to the world.